chest pain is a very common complaint, both in young and older patients. Most of the causes of chest pain are benign, i.e., not sinister or not worrying. Very commonly, when we exercise in particular, or we have done something a bit strenuous, we may pull a muscle, and that can cause symptoms of chest pain, especially when we breathe in. Sometimes inflammation of the cartilage in the rib cage, which again it's a benign condition, can give you symptoms of chest discomfort. And of course, if you have pulled one of your muscles in the chest or in the back, when you move, especially when you turn, you may experience chest discomfort. So that can be a common finding both in young and older patients. And of course, those symptoms tend to subside by their own. Another common cause of chest discomfort is inflammation or irritation of the lining of the heart, of the muscle, what we call pleurisy or pericarditis. That can be caused by a viral condition. If you have a viral infection, that can sometimes affect the lining of the heart or the lungs. And again, in the vast majority of the cases, that is benign, and it tends to either subside on its own or require a few-day treatment with non-steroidal anti-inflammatories. Sometimes, if we have reflux or if we had a heavy meal, sometimes you can get a burning sensation in your throat and your chest, what we call as acid reflux. And again, unless that is something that is consistent, happens on a daily basis, if it happens every now and then, very rarely, then again, that is tends to be a benign condition. Of course, chest discomfort can also have more serious causes that relate to this. For example, disease of the arteries of the heart, or disease of the heart muscle or heart valves can cause symptoms of chest discomfort. And if that is something that concerns you, then of course you need to discuss this with your GP or a cardiologist. It depends on the frequency and the context with which the chest pain comes. So if it is something that has happened, let's say recently, and you notice that every time you go for a long walk or every time you do something strenuous, you get this chest discomfort, then I would suggest that you have that assessed with your physician or cardiologist. Having said that, if it is something that you have had in the past for 2-3 days, and then it disappeared, and then it appears again after 2-3 months, and it's something that you have experienced in the past and you're aware of the nature of the chest discomfort, and then in that context, then you're most likely to be reassured. So what I tend to say to my patients is this: if it is something new that you have not experienced before, and it is something that comes and goes, especially when you exert yourself, and has remained for more than a few days or a week or so, or a few weeks, then especially if you're concerned, you should have that assessed. Again, I think it depends on the patient, and depends on their medical history. So patients are older, or that have risk factors for coronary artery disease or ischemic heart disease, such as high blood pressure, diabetes, positive family history, high cholesterol, history of smoking or previous history of smoking, then if you have chest discomfort, especially when you exert yourself, you should have that assessed. Again, different patients have different thresholds. So I stick to the advice that I've given earlier. If it is something that concerns you, and if it's a symptom that is consistent and you have not experienced before, I think if you're concerned, then you should have that assessed. It is a bit like when you look after your car. If your car makes a new sound that you have not experienced before and you haven't encountered before, and something that worries you, then you, of course, take your car to your mechanic. You should treat your body the same. Listen to your body and listen to yourself. If you're concerned about your symptoms, then go and see your physician or cardiologist. So chest discomfort that relates to heart conditions, especially coronary artery disease, tends to happen on exertion. So for stable coronary artery disease, it has developed over a number of years. Once the vessel becomes narrow enough, then blood supply to the muscle is affected. Therefore, when you start doing stuff, and therefore the oxygen demand for the heart muscle increases because the heart needs to do more work, then that's when you start to experience chest discomfort. So it tends to be on exertion. So when you exercise, go up the stairs, do your shopping, carry heavy lifting, that can cause symptoms of chest discomfort. A note of warning here, however, heart attacks, which happen acutely, of course, do not happen on exertion. They happen at rest. So if you have symptoms that you experience as chest heaviness or chest tightness or as pressure on the chest, especially if they go up the throat and you feel sweaty or clammy with them, down the arm, or anything that does not feel normal, that relates to the chest area and lasts for more than 30 minutes, there is nothing harm. You will not suffer harm if you attend your local hospital and have that assessed. It would be disappointing and counterproductive if you ignore your symptoms to find out later in due course that you have suffered a heart attack. So as I said, if symptoms tend to last for more than 30 minutes, so chest tightness or chest pain or chest discomfort for more than 30 minutes, that is new to you and you have not experienced before, best to have it checked by visiting your local hospital.